Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about tattoos. By Indiana law, a tattoo is any indelible design, letter, scroll, figure, or other mark placed with the aid of needles or other instruments, or any design, letter, scroll, figure, or symbol done by scarring on or under the skin. A tattoo is a permanent mark on the skin, and this also includes permanent makeup. The practice of tattooing has been done for thousands of years. Early on, tattoos were made by rubbing powdered charcoal into cut skin. Some tattoos were used to signify status and accomplishments, gangs, or occupations. Now, at least 21% of all adults in the United States have at least one tattoo. The modern process of tattooing includes holding a handheld electronic device that has a tube which contains ink and a sterilized needle. The needle moves in and out of the skin to insert ink into the deeper layers of skin. This may cause some bleeding and pain. There are many risks involved with getting a tattoo. Allergic reactions are rare, and they may happen immediately or even years later. When they do happen, it can cause more trouble since the ink is hard to remove. You may even develop allergies to other products, such as hair dyes. Infections are also a possibility. Non-tuberculosis mycobacterial skin infections were the cause of clusters in 2011 to 2012 in New York, Washington, Iowa, and Colorado. It was caused from contaminated ink and was very hard to treat. It may require 4 to 6 months of medications or surgeries to remove the infected tissue, which can lead to scarring. Other possible infections include Staphylococcus aureus, hepatitis B and C, and HIV. You may also develop a granuloma, which is a nodule formed around the materials that the body thinks are foreign, such as the tattoo pigment particles. Keloids are raised scars that grow beyond normal boundaries. You may also develop MRI complications, which include swelling or burning at the tattoo site. It can also interfere with the image quality. Be sure to inform medical personnel of any permanent makeup or tattoo before getting an MRI. You may also experience regret or unhappiness, as tattoos can fade over time. Also, fads and preferences change. The tattoo may not be in style, such as in permanent makeup. Your body also changes, which can change the look of a tattoo. You may also not be able to donate blood or plasma for 12 months in the case of potential infections to prevent spread to others. There are many possible causes for tattoo complications. Products may be purchased online from sites that are not reputable or regulated. Ink may also be used for unintended purposes. Not all ink is for skin use, such as calligraphy or drawing ink, printer ink, or automobile paint. Even temporary henna tattoos can be dangerous, as this is a hair dye. Ink can also be contaminated during the manufacturing process or at the time of use by using non-sterile water to dilute it. It is important to note that no tattoo ink is FDA approved for skin injection. Other possible causes include unhygienic practices, such as not washing your hands, or by using unsterilized equipment. After getting a tattoo, be sure to look for possible signs of infection. Signs of infection at the site include thick yellow or green discharge, continuous oozing or bleeding, red streaks moving away from the tattooed area, worsening pain, unusual swelling, or a rash. Generalized signs and symptoms include fever, shaking, and chills. If you do experience any reactions after receiving a tattoo, be sure to contact your physician for treatment. Contact FDA's MedWatch at www.fda.gov/safety/MedWatch and inform your tattoo artist to help determine the source of the problem. It is important to take good care of your new tattoo. Be sure to clean the area with soap and water and dab it dry. Apply moisturizer, avoid sun exposure, avoid swimming while healing, be sure not to pick the scabs, and do not wear clothing that sticks to the tattoo. If you decide to have a tattoo removed, it can be very expensive. It may require several treatments, the tattoo may not fully remove, and it can lead to scarring. There are many different methods, and here are just a few. The laser method involves using a concentrated light to break up the ink, which is then passed through the body for removal. Dermabrasion is essentially sanding away the layer of skin with the ink. The excision method is cutting away the tattooed skin, then stitching together the remaining skin. The 410 Indiana Administrative Code 1-5 requires annual bloodborne pathogen training for all tattoo artists. It also states that those under 18 years of age may be tattooed only when accompanied by, or with written permission by, a parent or legal guardian. Gloves must be worn during tattooing and when handling contaminated waste or blood. Tattoo artists must use single-use, sterile needles only. Any reusable equipment must be sterilized first. Infectious waste must be handled according to Indiana law. Tattoo artists must also display patron rights information. Highlights from the Johnson County Ordinance No. 2005 includes hand washing facilities in each station. It must contain hot and cold running water, soap, single-use towels, and must not be in a public restroom. Tattoo facilities must have their sterilization and disinfection equipment tested monthly with the results submitted to Johnson County Health Department. The facility must obtain M-Poster license, and there are no temporary or mobile tattoo parlors allowed. Tattoo artists are not required to register with the Indiana State Department of Health, although they are required in Johnson County to be registered. They are also not inspected by the Indiana State Department of Health, but are inspected by the Johnson County Health Department. Tattoo artists are also not required to receive training or certification according to Indiana law. Here are some things to look for when choosing a tattoo facility and artist. Be sure the artist has a clean appearance and the environment is clean as well. Be sure that they wear gloves and sterilize the equipment, as well as disinfect the work and skin area. Be sure they open the sterile needle in front of you and use individual items, including the ink poured in disposable containers, and they dispose of the item after use. Make sure if any water is used to dilute or rinse equipment during tattooing that it is sterile, not distilled or tap water. Be sure the inks used are manufactured for tattoo use and not inks for other uses. Be sure that they have hand washing and hand washing capability and that they are registered with the local health department. This concludes the tattoo presentation. If you have any questions or concerns, please visit any of these websites or contact your local health department. Thank you.